Hey everyone, it's Coach Jordan here. I hope you're all staying healthy and safe during this crazy time. We're going to break up the monotony of quarantine a little bit and talk about preventative exams. There's so many different tests, different screenings, exams, vaccines for us to keep track of throughout our lives, and it can be hard to keep track of when to have those done. Luckily, I'm here to help break them down by age, by gender, and any other specifications to make sure that you're staying on top of your health. Prevention is the key word to preventative care. So that means the goal is to identify any issues that may occur before they become a problem. And these can help keep you healthy and active in managing any kind of chronic disease. The tests do depend on age, gender, family history, and other factors, which we will go over in this presentation. But most importantly, it establishes a relationship with your doctor and helps your doctor track your wellness journey before anything should occur. So, why are preventative exams important? Well, for one, it can detect developing diseases and prevent them. If something is detected, you have a better chances for treatment and finding a cure. You can identify those health issues early and avoid any kind of future risks. We can improve our health and our healthy habits, increase our productivity at work, and then enjoy a long and healthy, happy life. So, the first step is getting an annual physical. Getting an annual physical and making healthy lifestyle choices are key steps to good health and well being. Just like you would have your car checked, you're having your body checked for any issues. Scheduling your appointments a year out can be a good way to make it a priority and relieve you of making sure it's scheduled on time, one less thing you have to worry about. So, your doctor will ask you about your current health, your family history, any past illnesses you may have had. They'll check your vitals, they'll listen to your heart and your lungs, check your ears, eyes, throat, skin, check on your abdomen. They'll take your biometrics, your height and your weight, your blood pressure, and your heart rate. And they'll have you do blood work, which typically involves your blood sugar and your cholesterol being checked, among a ton of other things that they'll go over with you. Eye exams. So, eye exams are often forgotten about, especially if you don't wear glasses. But even if you don't wear glasses, you should still have your eyes checked every 2 years. If you do wear glasses or contacts, it's important to have your eyes checked every year. But as we get older, our risk for different eye diseases increase, especially if you have diabetes or high blood pressure. So, if you're between the age of 40 and 54, you want to have your eyes checked every 2 to 4 years. If you're between 55 and 64, you want to have those checked every 1 to 3 years, and 65 or older every 1 to 2 years. We're going to switch over to our female friends and talk about some preventative exams that they should be thinking about. So, the earlier that breast cancer is detected, the more likely it is that treatment can be curable. Mammograms can detect cancer up to 2 years before a lump can be felt. This is so important for prevention or treatment of breast cancer. So, between the age of 20 to 39, every woman should have a clinical breast exam done every 3 years. This is done in the office, typically by your gynecologist, and is almost identical to a self check. A mammogram should be done every 2 years from age 40 to 74. And after age 75, you want to discuss the benefits and the limitations with your doctor. It is recommended that every woman should do a self exam once a month. So if you detect any changes in your breasts, you need to contact your doctor. Um, breast cancer resource breastcancerresearch.org is a great resource for breast cancer information and has really good helpful tips on how to make sure that you're doing a self exam correctly. So, also for our women friends, we need to be looking out for cervical cancer. Almost all cervical cancers are caused by the human papillomavirus, HPV. It's a common virus that can be passed from one person to another. And there are two screening tests for cervical cancer. The most common is the pap smear. It's done in a gynecologist's office and it should be done every 3 years. Depending on your age, your doctor may recommend the HPV test, which looks for that virus that can cause these cell changes and cause cancer. But you want to talk to your doctor about each of these tests and which one would be right for you. So let's switch gears a little bit and talk to our fellas. Much like breast cancer in women, early detection is key to treatment for prostate cancer. So the PSA screening is a blood test done in the doctor's office. You should talk to your doctor to determine when to be screened for prostate cancer. Typically starts between the age of 40 and 50, depending on your risk factors. But men over the age of 50, African American males, and those with a history of prostate cancer are at higher risk. So if you're African American, you're over 50, your father, your brother, your grandfather may have had prostate cancer. It's definitely a conversation you want to have with your doctor to figure out when you should start screening for prostate cancer and how often you should be screening for that. Another screening is for colon. So let's shift again to our diabetic friends. Complications with diabetes is a leading cause of disability and death in the United States. And diabetics are typically at higher risk for some more serious health problems like stroke or heart disease and require a little bit more care than others. So for pre-diabetics, you should have your glucose and your A1C checked at least once a year. Remember, the A1C is that 3-month average of your blood sugar, and it just gives us a better idea of how stable your blood sugar is over time. For diabetics, you should have your A1C checked at least 2 times a year. Most doctors would like their diabetic patients checked every 3 months, so they have an up-to-date A1C every 3 months. But it's also really important for diabetics to self-monitor their blood sugar often. Keep a log of it so when you go back to your doctor, you can show them kind of how your blood sugar has been doing and they can compare that with your A1C. So here's a comprehensive list of exams diabetics should take into consideration. A1C, cholesterol, and lipid panel at least 2 times a year, along with the yearly eye exam. Self-monitoring your blood pressure weekly if you don't have high blood pressure issues, and every other day if you do. Your doctor may also ask you to have some other screenings. Some of those might be a CAD statin therapy or a nephropathy screening or ACE and ARB screening. So some other preventative screenings you want to think about and immunizations. So during this time, we may start seeing now more people getting the flu shot as we're seeing how easily viruses can spread throughout the nation, and we're currently living this virus pandemic. So flu vaccinations once a year. I would suggest getting them around September once flu season starts. Ages 2 to 110. Pneumonia immunization, you would want that between age 3 to 64 for those who have a chronic condition. So some of those chronic conditions could be asthma, compromised immune system, diabetes, hypertension. You may want to talk with your doctor about getting that pneumonia immunization. But for everyone over age 65, it is recommended. Osteoporosis test for women, especially a yearly bone density test at age 65 or older, and a cholesterol and diabetes test for all adults. Those are typically done at your annual physical, but just in case there's any kind of discrepancy, you definitely want that cholesterol test at least every 5 years if there are no risk factors, and that diabetes test every 3 years if there are no risk factors. Just some other considerations to talk with your doctor about when you're at your annual physical. You can ask them about checking your vitamin and mineral levels. You can ask them about checking your hormone and thyroid levels. Most doctors typically check those, especially if that's something that you've communicated with them before. But if you're unsure or you're interested in knowing what's my B12 level, how's my testosterone doing, how is my thyroid doing, talk with your doctor and see if those additional tests are right for you and how often you should be checking those. So, for those with kids or grandkids, you know how important the well child visits can be. Not only are they getting all their shots and their required immunizations, but they're tracking their physical and mental developments as well. And it's critical in those first 3 years. As a parent, I know how hard it is to keep up with all the doctor visits. I mean, those first 3 years, you really feel like you live at your pediatrician's office. So this chart just kind of helps me remember how to stay on track and make sure that they are getting all of their well visits and all of their required immunizations. So 3 physical exams by 6 months. You'll have 5 before they turn 1, 2 exams between 1 and 3, and then it goes to once a year from 3 to 21. And that also carries over into your adult physical examinations past 21, that annual physical. So here are some additional sources for information, some that we used on these PowerPoints as well. If you have any other questions or any concerns and would like a little bit more information, feel free to use any of these links. And also remember, a good source for any and all health information can be found on the CDC website at cdc.gov. It's that second one listed. Has a great search engine. If you have any health issues or you'd like any resources or additional information, the CDC is your first stop. So let's get down to the nitty gritty of why we are all here. We want to get that healthy credit. So to get the healthy credit, you just need to email or text me the answer to this question. I'll give you all about 2 weeks and I'll send out a text reminder to get those sent in to me as soon as possible. Your question is, name one reason preventative exams are important for our health. Thank you all for tuning in and listening to this healthy break. Hoping that we're going to be able to use these virtual healthy breaks in the future. So I'd love any feedback you guys could give me on how you like it or don't like it, or things to improve. I hope you all stay safe and healthy out there. And if you need anything, please feel free to give me a call. If you don't have my number, it's 205-222-2215. Thank you all. Stay safe.